Hello, I'm urologist Omar Erdamakaya. Today I am going to give a short video presentation on erectile dysfunction and drug treatment. There are many molecules called phosphodiesterase inhibitors that have been actively used to treat erectile dysfunction in the last 20 to 30 years. The most commonly used molecules in Turkey are, in short, sildenafil, vardenafil and tadalafil. Sildenafil, as everyone knows, is Viagra or its counterparts with other generics. Tadalafil is Cialis or Lifta, again there are many generics. Vardenafil is Levitra. These are products most commonly used for sexual problems to increase blood flow to the penis. The most commonly used, of course, is sildenafil Viagra or tadalafil Lifta or Cialis. What is the difference between them? Why are they different from each other? I will briefly talk about them. Here Viagra provides a fast and strong effect. It provides the patient with an increase in erectile strength within 2 to 6 hours, an increase in blood flow to the penis. The difference between Cialis and Lifta is the patient's erectile strength. It works slower, but longer. Less powerful, but longer. So when the patient takes tadalafil Lifta or Cialis, the erection strength remains higher for a longer time. In other words, Lifta or Cialis is called a weekend drug in Europe. If the patient takes it on Friday, it provides high erectile strength until Monday. Viagra, on the other hand, increases erectile strength by providing rapid action within an hour of taking the drug, allowing sexual intercourse. This is one of the most important differences here. Let's say the patient has sexual intercourse 4 or less times a month with a planned schedule. If the time and day of intercourse are fixed, as some patients prefer, this patient can use Viagra. However, if the patient wants to have spontaneous intercourse and does not want to schedule medication before intercourse, then he should take tadalafil. Or as I said, Cialis or Lifta, he has to take those medications. Frankly, I do not think it is appropriate to take any of these medications without a doctor's supervision because they carry risks and harm. It should also be said that patients should definitely take these drugs on an empty stomach. Under normal conditions, it is said that tadalafil should be taken 1 hour before sexual intercourse, but I suggest that tadalafil should be taken at least 6 hours before and on an empty stomach. For Viagra, 1 hour is enough. After taking these medications, patients are sometimes afraid, what if my erection never goes back? What if my erection never ends? Will I be aroused for 8 hours after taking Cialis? That is not the case. The erection is caused exclusively by external stimulation. When the external stimulation is over, the patient returns to his normal state. But suppose the patient wants to have sexual intercourse again after 24 hours and was stimulated, he gets an erection again. One of the most frequently asked questions is whether Viagra harms the heart. Actually, Viagra does not harm the heart directly, but the patient tries to put himself in a high capacity for sexual intercourse, which will force himself with this erection strength. Normally the patient does not have so much effort capacity, but when he has an erection, he puts himself in a high effort capacity to take advantage of this opportunity. But the heart cannot handle that. Before I give these medications, I get an opinion from a cardiologist to determine if the patient will have problems with the medication. Depending on that, we give the patient the treatment. These medications can interact with some other medications. They can interact with blood pressure medications or medications that are used for heart failure, which we call the nitrate group, and cause a serious drop in blood pressure and problems for the patient. The most common side effects of Viagra or Cialis are facial rash, nasal congestion, headache. And these may even be the reason why the patient stops taking these drugs, especially headaches. Patients may say, I have a rash on my face, I have a headache, and stop taking the drug. Of course, these complaints are less common with tadalafil. That being said, another frequently asked question is it addictive? It is not addictive, it is not physically addictive, but psychologically the patient may feel incomplete and inadequate if he does not have these drugs with him. If he does not have these products with him, the patient may not even want to touch or get close to his partner. If he had sexual intercourse under normal circumstances, he would probably be erectile. Sometimes it is the case that the patient happens to have erectile dysfunction. After he starts taking these drugs, even if he has a spontaneous erection, he ignores it and takes one of these drugs. Do these medications increase sex drive? These drugs can increase sex drive, again not directly but indirectly as sexual strength increases. This may be good for the patient's loss of sex drive. Is it good for premature ejaculation? It has been proven in numerous publications that both Viagra and Cialis help with premature ejaculation. They have been shown to significantly prolong ejaculation times. But its contribution to premature ejaculation is as follows. The increased erectile strength gives the patient confidence, and since it takes away anxiety and fear, the ejaculation time is prolonged. Can these drugs be used in combination with each other? Something like that has been specified in the guidelines. We can now also recommend tadalafil for BPH. That's what the urology guidelines say. However, it says that the patient should take 5 mg of tadalafil daily and take a Viagra on the day of intercourse. Now, I do not necessarily recommend that, but there are treatment guidelines that recommend that combination of medications in patients. Before using these medications, a doctor's checkup is recommended. It is necessary to say why and how to use them. So it seems that these medications will continue to be used, because patients have a great benefit from them. We even see that these drugs are mixed with other products, such as chocolate, sodas, delicacies, coffee and pastes. We see those. They are mixed with pastes mostly. It is now possible to find them in many herbal stores. But you should be careful because the dosage and the content of the product can change. Thank you for listening and best regards.